Remodulin, treprostinil injection. For pulmonary arterial hypertension, WHO Group 1, to diminish symptoms associated with exercise.
Yeah, all right. I started having some trouble going upstairs. It was hard for me to even walk down the hallway. They did some tests on me and discovered that I had pulmonary hypertension. I worried, would I ever have a family? Would anyone be able to love me? Would I be able to get a job? Would I make a difference in the world? Would my life matter?
Out in California, I had such a fast-paced lifestyle. A lot of my life was work. It was constant travel, 12, 16-hour days, red-eye flights, packing one suitcase and having the next one packed for the next trip. I had been traveling for about 4 weeks, right before I was diagnosed. It was clear that I had to make changes to be able to balance my life with pulmonary hypertension.
Good job, all right. Let's ride. We're gonna go this way, okay? Let's go this way. At this stage in life, my most important role is being a mom. Good job, bud. Ethan is almost 3. We adopted him in March 2014. He was 3 days old when we got to hold him for the first time. He knows that mommy takes her medicines at certain times, and he knows that my pump is not a toy, and when I make my medicine, he can't touch that area. I am currently on the IV Remodulin. Now that I'm used to it, mixing the medicine, it's like second nature to me. But when I first learned that there was an IV pump medicine that I could go on, I was really scared about it. I thought that I would be like an alien with some sort of weird tubes coming out of me. There was a specialty pharmacy nurse who came and showed me how to mix the medicine, and she was just so warm and welcoming. Not only did she teach me how to mix it, she gave me ideas for like where I could wear the pump if I was wearing a dress. Just coming up with new ideas of how to make Remodulin work in my daily life.
Being diagnosed with PAH, I had to reprioritize my whole entire life. After about 1.5 years, I made the decision to walk away from the dream job I'd had for 10 years. It was just too much for me. And I was the only one on the West Coast. I didn't have any family around, so I made the decision to move across the United States to New Hampshire, which I still think I'm a little crazy for right now, going from sunny to 5 degrees with snow. But both my dad's family's here and my mother's family's here too, so it's kind of like I'm back with everybody. Hi. Hi. Just pick it up and do whatever you want to do. Okay. Just dabby dab, like Aaliyah dabba dabs. Okay. The diagnosis affects your family members too, and you need to reach out to them as well so that they understand what you may be feeling and you can maybe understand what they're feeling.
I know it's just such a different lifestyle than living in LA and what she has been doing for the last 20 years, but I'm super happy she's here. My sister has always been my best friend and the person who knows me the best.
I think everything in life, you have to consider the pros and the cons. I mean, it's a pump that you have to carry around, but the pros, in my opinion, have really outweighed it. I get more energy. I'm able to work, play with my son, have a family, continue with pursuing my dreams. I was really inspired by the nurses that took care of me. I definitely would never have become a nurse if I hadn't have been a patient first. I wanted to be able to give something back. I'm actually a nurse at the hospital where I was first treated for PH.
After speaking to my doctors, I chose, because of the lifestyle I had at the time, to go with the subcutaneous method. Taking showers was a big challenge. And then I just talked to other patients. How do you waterproof, and what supplies do you ask for from the specialty pharmacy? So it's just learning what tools they have to help make everything better and finding that network in a support group. I've come a long way. It took a while for the pain management, but my doctors and I came up with a plan. I do have a pain medication and a topical cream that I use. Now it's a lot better. I can manage it a lot better. I can still work. It's just, I had to learn not to run myself ragged. I just had to relearn my body.
Hey, buddy. How was your day?
I would never wish a disease like PH on anyone, but in some ways I wouldn't wish it away from my life, even though it sounds really strange, because it's taught me a lot and it's made me the person that I am today. I never imagined that I would be married to an awesome man and have the most amazing son and a job that I really enjoy. Just keep going, just keep trying. It might end up being even more awesome than you thought it could be.
With the spoon so it doesn't drip on the stove.
I've definitely learned how to slow down. I don't define my life by my work anymore. Got it. I'm grateful that I'm near my family now.
It's a journey, and the journey is kind of like it's just starting again for us, you know.
When I'm cold, bring me in.
Being together and being this close.
I still do that, I think, when I first... What I've learned since my diagnosis is that I've had to be a lot more gentle with myself and just take small steps. Being diagnosed with PAH changed how I started looking at things. When I look back on it, I see life as a gift now.
Indication: Remodulin is a prescription medication used in adults for pulmonary arterial hypertension, WHO Group 1, to diminish symptoms associated with exercise. PAH is high blood pressure in the arteries of your lungs. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. Remodulin is delivered or infused continuously using a pump connected to a small tube that is either placed under the skin, subcutaneously, or inserted into a vein in the upper chest, intravenously. Because there are risks associated with continuous IV infusion, such as serious bloodstream infections, IV infusion should be reserved for people who cannot tolerate sub-Q infusion, or for those in whom the risks are considered acceptable. In people with PAH who need to switch from Flolan, epoprostenol sodium, Remodulin is approved to slow the worsening of symptoms. The risks and benefits of each drug should be carefully considered before switching. Important safety information for Remodulin. Continuous intravenous infusions of Remodulin are delivered using a tube placed in a central vein within the chest. This type of delivery is associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous infusion delivered just beneath the skin is the preferred type of delivery. You should not stop or greatly reduce your Remodulin dose without consulting your doctor, as this may cause your PAH symptoms to worsen. Other medical conditions and medicines may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. It is important to tell your doctor about your medical conditions and any medicines you may be taking. If you have liver or kidney problems, your ability to tolerate Remodulin may be affected. If you are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes, your doctor may need to adjust your Remodulin dosage. Remodulin acts by lowering your blood pressure, In some cases, your blood pressure may become too low and cause other side effects. If you also take other drugs that lower your blood pressure, the risk is increased. You should discuss all of your symptoms with your doctor, including those associated with low blood pressure. Because Remodulin can reduce the blood's ability to clot, it may increase your risk of bleeding, especially if you are taking anticoagulants or blood thinners. If you are pregnant, breastfeeding, or planning to become pregnant, talk with your doctor about whether you should take Remodulin. Side effects. In clinical studies of sub-Q infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, and swelling. These symptoms were often severe and sometimes required treatment with narcotics or discontinuation of Remodulin. The IV infusion of Remodulin has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. Other common side effects seen with either sub-Q or IV Remodulin were headache, diarrhea, jaw pain, nausea, vasodilatation, widening of the blood vessels, and edema, swelling. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying full prescribing information for Remodulin. For additional information, call customer service at 1-877-864-8437.